how would you know if you've got dry eyes? Well, first of all, it's incredibly common. Here in the UK, about 1/3 of the adult UK population have got it. So if you're out in a group of 3, one of you likely has dry eyes. Now, dry eye is the most common problem I find in patients, and half the time, patients actually don't realize they have it. And because of the damage that dry eyes can cause, I'm going to give you the top 5 red flags to look out for. Warning sign number 1 is excessive tearing. Do your eyes water easily? Well, believe it or not, watery eyes can actually be a sign of dry eye syndrome, which happens in about 40% of those with dry eyes. It's all about oil and water. Now, you have lots of vital oil glands in your eyelids called meibomian glands. They're named after Dr. Heinrich Meibohm, a German doctor who first described them in 1666, in between writing Latin poetry, which was his hobby. The oil coats your watery tears to prevent evaporation, like putting cling film to keep your food fresh. Now, if you aren't making enough oil, or the oil isn't the right quality, the watery layer of your tears just evaporates too quickly, creating dry spots. In response, your lacrimal glands, which are over here, pump out lots of extra tears to compensate. The result of that is watery eyes, even though they're actually dry. Warning sign number 2 is redness and irritation. Are your eyes frequently red and irritated even when you haven't been crying or exposed to irritants such as pollen? Chronic redness is a common sign of dry eyes. Well, why would that be? Well, it's because the underlying foundation of dry eyes is inflammation. And the first line of treatment now isn't adding teardrops like we did years ago. It's giving anti-inflammatory drops or tablets, which will quickly reduce the redness. Red eyes aren't normal, so if you've got them, please get them checked out. Warning sign number 3 is itching. Now, this might surprise you because most people think of hay fever or allergy when you get itchy eyes, but actually it's one of the most common symptoms of dry eyes, happening in about 1 in 5 patients. Other symptoms include burning or stinging. Well, how can you tell the difference between itching from dry eyes versus allergy? Well, allergic conjunctivitis typically causes more intense itching compared to dry eye, and it often has more noticeable redness and swelling with allergy. Also, allergic conjunctivitis often comes with other allergy symptoms like a runny nose or sneezing or an itchy throat. Very familiar to those with allergies. Now, the allergy symptoms typically respond well to antihistamine eye drops or tablets, but not if it's caused by dry eyes. Now, warning sign number 4 is blurry vision, especially after some prolonged screen time. Using screens for hours a day can double your chance of getting dry eyes. Your cornea here at the front of the eye acts as a powerful lens to bend and focus light onto your retina, a process that's called refraction. But the point at which light bends is actually on the tear layer, as light rays pass from the air into the watery coating of your eyes. And if that tear layer isn't smooth and stable, you no longer have a beautifully polished lens surface, and the result of that is blurred vision, especially intermittent blurring that improves when you take a blink. This symptom is much more common with screen use because we blink 3 to 5 times less often on our devices, and so there's more time for tears to evaporate and get patchy dryness across your cornea. Plus, for some reason, we make more partial blinks when we're on a screen where the upper lid doesn't wipe across the whole cornea. Now, take regular breaks to make sure you keep blinking. Warning sign number 5 is persistent dryness or grittiness. Did you know there are more nerves per square millimeter in your cornea than anywhere else in the human body? A nerve irritation is a cornerstone of dry eyes, leading to gritty or sandy feelings, or like this says something in your eyes. In the Salisbury Eye Evaluation Study of 2,482 volunteers, 1/3 of people reported experiencing grittiness sometimes, often, or all the time. So we know it's a common symptom. If your eyes often feel dry or gritty or like there's sand in them, this could be a sign of dry eye syndrome. Now, if you're getting one or more of these 5 warning symptoms and signs, and they're not going away, it's best to book to see your local optometrist or your eye doctor. There are now lots of options for dry eyes beyond just lubricating tears, and improving dry eyes is a routine part of the preparation for laser eye surgery. And if you want to learn more about getting laser eye surgery, watch this video next.